The first transplant was actually a cadaveric living donor transplant, and that was the first cadaveric donation actually for the entire state of Punjab. When it comes to cadaveric donation, a 1-day-old baby to a 99-year-old gentleman can donate organs. Okay, so there's absolutely no age range for you to donate organs after death. Multiple tests are going to be done to check whether the organs are viable, and only then we will go ahead and retrieve these organs. And
right. So how do you see transplant surgeries or complex surgeries like this in 10 years from now? Would it be replaced completely by automated systems?
Well, that's a very good question and a very difficult question to answer at this point in time. But having said that, we are actually using AI to plan our surgeries.
Hello, welcome to Spandana podcast in collaboration with Dr. Seema Skincare and Laser Center. I'm your host today, Dr. Seema, along with Emmanuel. And today we are kickstarting our first podcast with the most accomplished multi-organ surgeon, Dr. Suresh Raghavaiah. Dr. Suresh Raghavaiah is not only a multi-organ transplant surgeon, he's also a hepatobiliary surgeon. He started his surgical journey at St. John's Medical College, Bangalore, and thereafter he went and did minimally invasive hepatobiliary surgery in Paris. And after that, he was very fortunate enough to do his transplant fellowship at Mayo Clinic, USA. In this episode, we are going to have an in-depth conversation with Dr. Suresh Raghavaiah about liver, kidney, as well as pancreas transplantations.
So, Dr. Suresh, thank you very much for taking time out to sit with us today.
It's my pleasure, Emmanuel and Dr. Seema. Thank you for having me.
So, first of all, Doctor, what led you to take this specific branch of medicine?
So, ever since I can remember growing up, I've always wanted to be a doctor. And once I got into medical school, I think all my teachers inspired me to be a surgeon. And I was one of the lucky few people to train in surgery at St. John's Medical College. Now, St. John's Medical College was one of the first institute in Karnataka actually to do a liver transplant. So that legacy was always there. And they do a lot of kidney transplants as well. So I was very inspired and got interested in this field. And then, last luck would favor it, I ended up going to Paris for a laparoscopic HPV fellowship. And then I was fortunate enough to go to Mayo Clinic, which is a mecca of medicine, and trained in multi-organ transplant surgery. And now I'm back in Karnataka, doing this specialty right now.
Right. So what is this multi-organ transplant? What exactly does it?
So multi-organ so I'm trained to do 4 different organ transplants. So I can do liver transplants, kidney transplants, pancreas transplants, and small intestine transplants. So in India, most generally, the surgeons get trained in one or the other organ transplant. So it's only in the US where you get exposure to do all these multiple organs, where you can come back and do all the 4 organ transplants. And that's what multi-organ transplant surgeon means. And that also entails is that a single patient can get multiple organs. So, for example, liver and kidney combinations are a lot, where patients with liver failure end up getting kidney failure as well, and we do liver and kidney. And we do what is known as simultaneous kidney and pancreas transplants as well, where kidney failure is there and diabetes is there, and we do both kidney and pancreas transplants at the same time. So that's what multi-organ transplant is.
Dr. Suresh, we're all well aware that you're a very accomplished surgeon. Can you tell us a little bit about your first transplant and how it actually took off?
So after coming back to India from Mayo Clinic, I actually went to Punjab. I was not in Karnataka. So there's a special place called Dayanand Medical College over there. And we actually did the first liver transplant for the state of Punjab.
Oh, now, wow.
Punjab has a lot of liver disease over there because of hepatitis B, hepatitis C. I think the fatty liver is a lot and alcoholic liver disease is a lot. And unfortunately, the people in Punjab had no access to liver transplant services. All of them had to travel to Delhi to get the services. So I got to Dayanand Medical College, and along with one of my colleague, Dr. Raman, we actually started the liver transplant unit in Dayanand Medical College, and we ended up doing the first liver transplant over there. The first transplant was actually a cadaveric living donor transplant, and that was the first cadaveric donation actually for the entire state of Punjab. And following that, we also did the first living donor liver transplant for the state of Punjab. So those transplants really do hold a special place in my heart, because we actually set up the complete liver transplant unit from scratch. and kind of getting it to the point where we could actually do the first transplant was always very special.
Are you still in touch with the patient who you did the first transplant?
Yes, I think they always call me and wish me on my birthdays and the anniversaries, and most importantly, they call me on their anniversary of the liver transplant. Both the daughter had donated to the father, and both of them call me and always wish me and to say thank you.
So you said that the first transplant you did was a cadaveric donation.
Right.
So what exactly is it like the organs are harvested from a deceased?
That's a very good question, Emmanuel. So, what does cadaveric organ donation mean? Is basically we have a concept called brain death when it comes to organ transplant. So, what is brain death? Now, we have a brain which controls all the functioning of our body. It controls the functioning of the heart, controls the functioning of the lungs, the liver, our breathing. Everything is controlled by the brain. More specifically, what we call as a brain stem. Now, what happens is, let us say a patient has had a severe accident where he's had severe head trauma, has had a stroke or a bleeding into the head. What happens is the vital center controlling these organ systems fail. Meaning what? If at all we take him away from the ventilator, the patient is not going to breathe, and so that he dies. Now, what happens is most of the time without the brainstem control, the heart will continue to beat for about 48 to 72 hours nicely. The patient is no longer alive, okay, but the heart continues to beat, and this is the concept of brain death. And these are the set of patients where we call about cadaveric organ donation or deceased donor organ donation. So in this narrow period of about 48 to 72 hours, we do a lot of testing to make sure that there is not even a less than 1% chance of this patient coming alive after treatment. So only we do a lot of tests, we confirm brain death, and then we go and counsel the family saying that your loved one is no longer with you. Would you like to donate your organs? And in Bangalore right now, with all the educational activities and the propaganda which is happening with respect to brain death donation, most people graciously come forward to donate their organs, and we take them to the OR. And when the heart is beating, we kind of go ahead and operate and remove each and every organ in the body to donate to the needy ones.
Right. And that brings me to the next question. Like, who can donate an organ, and how important is it for people to volunteer to donate organs?
Oh, that's a lovely question, Mr. Emmanuel. And it's a subject which is very close to my heart, because right now, if at all you look at the number of people who need organ transplants in Karnataka itself, I would say about 1,500 people have registered with the government to get a liver transplant. There are more than 6,000 people living with kidney failure who needs a kidney transplant right now. There are about 20 people needing a pancreas transplant. There are about 50 people needing a heart transplant and lung transplants. So lots of people are waiting for transplants. Now, when it comes to organ donation, we'll talk about living donor donation first, and then we'll talk about cadaveric donation. Living donor donation is where when somebody loving in your family come forward to donate organs. Now, what are the organs we can take from you? We can take one kidney. You can absolutely completely lead a normal life with just one kidney, and the donor life, you will have absolutely no impact on the quality or quantity of life after organ donation. Now, same thing with the liver. We can take half the liver and we can give it to your loved one, and somebody suffering from liver failure, and the patient will be all right. And the magic thing about the liver is the liver grows back. So when it comes to living donation, you can donate either half your liver or one kidney. Now, obviously, there has to be blood group matching. There are a lot of legal formalities to prove that you guys are related, and only then you can donate. Now, unfortunately, for most of the people, you do not have a living donor in the family. Maybe the blood group doesn't match, maybe the age isn't conducive for donation, or for some other reasons, you do not have a living donor in the family. And the only hope for you to survive after that is to get a cadaveric organ. So you go register with the government, which is called as the SOTO, where the government maintains a waiting list of all the people who are registered, and we wait for a cadaveric donor. Now, when it comes to cadaveric donation, a 1-day-old baby to a 99-year-old gentleman can donate organs. Okay, so there's absolutely no age range for you to donate organs after death. Yes, we are going to test the organs, whether they are functional, whether it is going to function after transplant. Multiple tests are going to be done to check whether the organs are viable, and only then we will go ahead and retrieve these organs and donate. Now, if one person like me or you can donate organs after death, you can save up to 8 people. So we can take 2 eyes, 2 lungs, 1 heart, The liver is there, which can be split into two. There are 2 kidneys. You can donate your pancreas and you can donate your small intestine as well for the needy people. So this is going to give them a second chance at life for these people. Now, unfortunately, what has happened, the number of people actually coming forward to donate is very less as compared to the number of people waiting for an organs. So, give you a short example. I think last year we had about 180 donations in Karnataka,
Wow.
whereas more than 6,000 people are waiting for life-saving organ transplants, and most of these people end up dying on the waiting list itself. So yes, everybody should come forward to volunteer to donate their organs after death.
Thank you, doctor. You did tell us about all the organs that can be donated during a transplantation, but you did forget to mention about the skin. We do a lot of skin transplants as well, especially for burns patients and patients suffering from accidents. So yes, we'll include that as well.
Thank you. My mistake.
So we understood how who is someone who can receive organ, but also we missed out on the largest organ in a human body, that is skin. So Dr. Seema, what is your take on skin
Yes, he
transplant?
did miss out on that. Skin transplant is life-changing, especially for burn victims. They get a new lease on life. Now that you made us aware about how living donor transplantation works and cadaveric donor transplantation works, can you brief us about who are these patients who need transplantations in the first place?
Very nice. So basically, anybody suffering from organ failure is a patients who need organ transplant. Now, let it be liver, let it be kidney. So whenever kidney failure is there, I'm sure anybody and everybody will know somebody in their family who are on dialysis. Basically, kidney failure is there. And nowadays, what's happening is diabetes is very rampant, and the number one cause of kidney failure, I would say Karnataka, India, and the world over, is going to be diabetic kidney failure. For somebody who's not taking care of the diabetes or hypertension, over time, the kidney is going to get damaged and they're going to get a kidney failure and they're going to go on dialysis. And these people do extremely well with a kidney transplant. Now, multiple studies have shown that a kidney transplant operation not only prolongs the life of the patient, but improves the quality of the life of the patient by a whole lot. So any patient who's on dialysis or who's impending dialysis, I would say is a very good candidate for a kidney transplant. Now, when it comes to liver transplant, there are 2 categories of people. One of them, what we call as acute liver failure, meaning they had some infection, they had some suicidal injection of Ratol, which is available, or maybe they took some TB medications and they had a bad reaction to the TB medications. The liver suddenly fails, what we call as acute liver failure, and these people are going to need an emergency liver transplant. Otherwise, within about 3 to 4 days time, they are going to pass away with liver failure. Now, the second subset of liver failure patients are what we call as chronic liver failure patients. Now, these are the patients who drink or who have fatty liver, who have neglected their fatty liver, who have hepatitis B infection, hepatitis C infection. These people over a course of multiple years are going to slowly undergo liver damage, end up in what we call as cirrhosis of the liver. Now, once cirrhosis of the liver sets in, unfortunately, the liver cannot repair itself. It is a permanent damage to the liver. And going forward, what's going to happen? They are going to suffer symptoms of liver failure, like jaundice is going to come. They're going to develop a huge belly because fluid is storing in their abdomen. Swelling of the legs is there. Their albumin level goes down. They start getting confused, which is called hepatic encephalopathy. They vomit blood because of varicose bleed, or they pass black color motion. So these things, once they reach this stage, it is very unlikely that their liver functions are going to recover. And these are the patients who will benefit from a liver transplant. Now, one of the special organ transplant I'd like to talk about, which I'm very passionate about, is pancreas transplant. Now, when do we do pancreas transplant? So this is for type 1 diabetic patients. Now, here what is going to happen, for some reason, because of a viral infection, because of a genetic condition, whatnot, their own native pancreas is not producing any insulin. So they get type 1 diabetes. Now, in this, what happens? The sugar levels vary widely. They can have high sugars, then suddenly they don't eat anything, they develop low sugar. So the sugar level is what we call as brittle diabetes, and this generally develops in childhood. Now, once they develop diabetes in childhood, over time what happens? They're going to develop kidney failure, so what we call diabetic renal failure. And in these subset of patients, we're very happy to say our team has done the maximum number of pancreas transplants in Karnataka, and we are probably the 3rd highest in India.
Wow.
So what we do over here is, now the patient has come for dialysis, he's come seeking a kidney transplant, and then we counsel them that you have diabetes as well. Now, if you don't cure the diabetes, what is going to happen? The diabetes is going to actually damage the kidney, which they get as a transplant as well. So going forward over 10 years, the diabetes is going to damage this kidney, and this kidney is going to fail as well. But if you end up doing a simultaneous kidney and the pancreas transplant for this patient, the kidney failure is going to get them off dialysis, and the pancreas transplant will cure their diabetes. So what happens once the diabetes is cured, the kidney transplant life doubles. So normally, if you put a kidney transplant in a diabetic, probably you have about a 50 to 60% chance of the kidney failing within 10 years. Whereas if we cure the diabetes with a pancreas transplant, the kidney lives for about 18 to 20 years is what the studies have shown.
Yeah.
So that is one question that even I have. Because we had a kidney transplant that happened in my family very recently.
Okay.
So there was an argument that came up, no, just a mere transplant will not help because there should be some reason which caused the kidney to fail.
Right.
And if that is not addressed, if
Yes.
the transplant would not work. And we did not have an answer to it.
Yes.
But however, we had to go for a transplant.
Of course.
So now we have an answer.
Yes. And the good thing about a pancreas transplant is because you're curing your diabetes, all the other complications of diabetes which have happened over time, like your eye damage, your heart damage, blood vessel damage, nerve damage, everything arrests over there itself. And the lifespan of the patient really doubles after a pancreas transplant.
It's amazing to hear, Dr. Suresh.
So, Doctor, now AI is one of the most trending topics that we get to hear.
Right.
We hear about a lot of layoffs, how human interventions are being replaced by this new technology.
Right.
So, how do you see transplant surgeries or complex surgeries like this in 10 years from now? Would it be replaced completely by automated systems?
Well, that's a very good question and a very difficult question to answer at this point in time. But having said that, we are actually using AI to plan our surgeries. So right now, whenever we look at a complex, let's say a liver cancer tumor where we need to cut the liver and take out. Now, the thing about the liver is it's got a lot of significant blood vessels going very close to it. And when we do surgery, we have to be extremely precise when we're doing the surgery. So right now, we are able to construct 3D models of the same liver tumor, kind of do a virtual surgery, kind of plan out a surgery, and then safely perform the surgery with respect to when it comes to liver cancer. Now, the other place where we see AI is when it comes to donor and recipient matching. Okay, so already there are huge data sets available for the donor data and the recipient data. And right now, AI algorithms are there, which kind of match the donor to the recipient to get the best outcome, to see which donor, if they donate to which recipient, you'll have a better outcome. And what we call swap transplants are being facilitated by this respect. And yes, AI is definitely percolated over here. The other thing where we talk about AI is robotic surgeries. Now, let us say all these robotic systems have come, which can be controlled at a faraway place, right? So let us say we do not have a surgical expertise in Bangalore and we have an expert surgeon sitting in Delhi. So we can actually connect the robot to the console over there in Delhi, and the surgeon sitting in Delhi can operate on a patient using the robot in Bangalore. So yes, it is invading our space. That's the term to use, invading our space. So I do not know what the future holds, whether we will be able to get into autonomous robotic surgeries. We still don't know, but it's an interesting era to be involved with AI. Yes.
Dr. Suresh, we recently read in the newspapers and even on the news that you did a very unique case. Can you please tell us about it?
So I think you are referring to the first case in Karnataka where we did the pancreas after kidney transplant. So like I said, pancreas transplant is a very unique surgery, and I'm proud to say that our team has done the maximum number in Karnataka. So when we talk about pancreas transplants, normally they are done along with the kidney at the same time, which we call as a simultaneous kidney and pancreas transplant. So here what had happened is the girl, it was a 22-year-old girl who was working for an airline company, and she was an international patient as well. So she had come forward and she did not want to be on dialysis and wait for the organ. So what happened is her mother had come forward as a living donor, and she got the kidney transplant first, and she was off the dialysis list. So she was living happily with the kidney transplant. Then after about 6 months later, we listed her, once we were sure that the kidney is working well, we listed for the pancreas transplant alone. And by God's grace, she got a very good organ, and we were able to do the pancreas transplant. So this is the first unique case in Karnataka where we did the pancreas after kidney transplant, and the pancreas, started functioning well. And she was very happy. And it's about 6 months now since the surgery. She has gone back to her native town, and I keep in touch with her all the time. I'm happy to say she is doing extremely well. So I think this is probably the third case in India as well for such a case.
Quite an accomplishment.
Thank you.
And I also see a trend that you are still in touch with a lot of the patients that you have done transplant on. I mean, how does that work for you?
Yeah, so it is a good, when we talk about organ failure patients, they do come to us before the transplant for a long time. All of them are desperately waiting for an organ. So we have to manage their symptoms. They have come with a lot of fluid buildup, jaundice, they come with repeated infections. So what ends up happening is we do get a close bond with not only the patient, but also patient's family as well. So on an average, right now, the patients spend about 9 months to a year on the waiting list before we do the transplant. So in the meantime, we are helping them through this process. We are counseling them. The family comes to us to talk about their difficulties and what their challenges are to take care of these patients. And so we do develop a close bond. And once we do the organ transplant, they're ecstatic and they're very, very happy. And it gives us great satisfaction as well to do the transplant and to see them improve so quickly after transplant, after having suffered, almost a year or 2 years. So they're very gracious people. Most of our organ transplant patients are very gracious, and it feels very happy. And that's why they keep in touch with us. And always I personally have a strong bond with all my patients and love to keep in touch with my patients.
So, when we talk about transplants, there is a notion that not everybody can afford a transplant, be it liver, kidney, or pancreas.
Right.
So, can you brief us about how expensive are these transplants and how easy it is for a patient to afford these transplants?
So that is a very pertinent question to be asked, Dr. Seema. So yes, transplant is definitely an expensive process. Now, most people seem to think that the hospitals make a lot of money with transplant, which is a very wrong notion actually, because the amount of manpower and machine power and the facilities required to do a transplant is a lot. Okay, it is not a one-person job or a two-person job. For example, if you have to do a liver transplant, there are at least 12 specialist doctors involved to actually take care of these patients. He needs round-the-clock care immediately after transplant. He needs to be in an isolated ICU without any surrounding patients because the risk of infection is very, very high. So it does take a lot of manpower and specialized services to offer a transplant. So having said that, I would say a kidney transplant right now would set you back anywhere between about 8 to 10 lakhs, and a liver transplant anywhere between the ranges of about 18 to 25 lakhs, especially if you have a donor in the family. Okay. Now, yes, it is an expensive thing, but the problem is you do not look at transplant only from the cost basis. You look at it from the benefit of the transplant. Now, like I said, if at all you have an organ failure, you have repeated visits to the hospital, you have repeated admissions, repeated blood tests, repeated medications you need to take, and these things actually add up. And once we did an analysis that if a patient ends up waiting for an organ for about a year, not getting a transplant, he will end up spending more money actually without the transplant than doing the transplant at all. And then what you need to measure is the quality of life of the patient. The patient, if the transplant goes well, he gets to spend the next 30 years, 40 years with the family, happy, being a husband, being a father to your children. And I really think you can't put a price on that. But even though it is an expensive process, the other thing I would like to say is there are a lot of fundraising platforms available right now for our transplants. Milap is there, Keto is there, lots of crowdfunding platforms, and we've had huge success with respect to raising funds for our transplant patients. The government of Karnataka has a CM Relief Fund, PM Relief Fund is there. So there are a lot of avenues to raise funds, and we actually help our patients to go ahead and apply for these things. And no patient should be left behind wanting a transplant purely for financial reasons, and we make it a point that we help them to get these transplants.
Like you said, transplant surgeries are quite expensive, but I think the major problem that we are facing today is not the financial aspect, but the availability of organs. So, if at all someone would like to donate an organ, what is the steps or how do you guide them to?
That's a lovely question, Mr. Amir. Like I said, right now there's a huge shortage in the supply of organs, and I would really with folded hands request everybody watching the show to come forward to pledge their organs. It is very, very easy to pledge your organs. So all you need to do is go to Google and type in SOTO Karnataka, State Organ Tissue Transplant Organization. The first thing you will get is a QR code. You can just scan this QR code, put in a few basic details, your name, your age, your Aadhaar number, and your phone number. That's all they're going to ask. Then you can ask them saying that you can pledge your organs. So the moment you do that, you're going to get what is known as an organ donor card that you can carry in your wallet and you will be designated as a donor. Second thing, you can go to the RTO when you go to get your driver's license. Over there is a box saying that would you like to be an organ donor. You can tick the box and you get a small sticker to put on your on your license thing, which says you're an organ donor, and multiple avenues are there. But the most important thing rather, is to actually have a discussion with your loved ones about your intent to donate. The most problem what we have right now is to actually convince the families to donate their organs, and which is very understandably so. Imagine something happens to me tomorrow, I have an accident, I have a stroke. My family is going to be very sad, because I am no longer there with them right now. And this, at the height of their grief, imagine somebody coming and saying that, donate your organs. The first response is going to be anger. And that has happened with us as well. When we actually go and request patients, families to donate organs, they come to hit us. Now, why is this? Because they are not aware of your wishes to donate organs. So it is very important that you have a conversation with your family and loved ones, saying that in the fateful event that something bad happens to me and I get declared brain dead, please donate my organs. So what this does is, it helps the family to take a decision. Like I said, even at the height of grief, instead of anger, they will be like, my loved one actually wanted to donate his organs after that. So it will be a peaceful closure for them to actually come forward to donate their organs. So it is very easy to get donor designated. You really need not do. The one of the best thing which happened to eye donation was Aishwarya Rai pledging her eyes. The moment Aishwarya Rai came on TV and said she is donating her eyes, the number of donations actually increased exponentially. In Karnataka, our honorable actor, Dr. Rajkumar, donated his eyes. His son, Dr. Puneet Rajkumar, donated his eyes. And lots of awareness was created. And our Indian cricket team, during the Champions Trophy, actually they pledged their organs, and we had about 20,000 pledges within one short period of time. So yes, lot of information needs to be spread about organ donation, but it is not a complex procedure at all. It's a very simple 2-minute procedure to pledge your organs. And again, I reiterate, it is not important for you to pledge organs. It's more important for you to speak to your family about your intent to donate, so that it becomes easy for them to make a decision after your death.
So thank you, Dr. Suresh, for being our first guest in our Spandana podcast, coming all the way over and talking about not just organ transplantation, but also organ donation.
Thank you so much.
Thank you for this. You have really, truly inspired me. I'm hoping us as well to donate and pledge our organs after our death. I would encourage all of us to do the same. Thank you again for being a part of this lovely conversation.
Thank you,
Thank
Dr.
you very
Seema.
much, Dr. Suresh. And also, I would like to request our viewers to kindly subscribe to our channel, which would be a great motivation for me to come up with more such content. Thank you very much.